Hello everyone. I would like to welcome you to our informational webinar on the innovative new healthcare program offered by Keys to Health. Keys to Health is dedicated to providing affordable healthcare options to all Floridians. Please welcome Kevin Kennedy from our program sponsor, the Small Association Leadership Alliance, who over the next 20 minutes will give you all the important details on this exciting new membership program. Kevin?
All right, thank you, and welcome everyone to today's webinar on the state of the healthcare program. As you'll see, the program is affordable, accessible, and effective. In bringing the program together, about 3 years ago, we had two key points we were trying to address. We wanted to develop a national program and a program that reduced costs in a meaningful way. The program itself is really an effort to simplify what's become so complex with our healthcare system. We offer a great choice of high-end affordable healthcare solutions, and it helps folks meet the ACA regulations for preventative care. As you'll see on the bottom there, it's lowering healthcare costs by as much as 60%, and that's when measured against what folks are paying on the exchanges. It varies by where we all live. Those in more rural areas are paying more, so their savings are greater, while those of us in more urban areas are paying less, so our savings are still significant. My savings, for example, right outside Washington, D.C., is right around 50%. This last bullet here is perhaps the most important. We did a survey this past summer of all participants in the program, and 91% of participants report being very or extremely satisfied with the program itself. So it's really a great solution for folks to consider. The program itself is really an alternative approach to traditional health insurance. And in bringing the program together, we had two main partners. The first is Apex Management Group, and the second is Sedera Health. Apex offers great plans that are focused on preventative care, and there are two to choose from there, the Advantage Plan and the Basic Plan, and I'll talk about those in detail in just a few minutes. Sedera Health is medical cost sharing, and I'll spend a good part of the next 15 minutes or so talking about Sedera. But it's really with Apex and Sedera, along with a couple other partners such as Teladoc and WellDyneRx, that we get to a great, comprehensive, cost-effective healthcare solution. Our healthcare program, really healthcare in general, has three main components. Large costs, which we refer to as needs. These will be everything from running your kid down to the ER to get some stitches to a cancer diagnosis and everything in between. The significant events that usually involve us going to a hospital. Then there are small to medium costs. This is more the run-of-the-mill type stuff we all have throughout the year, a cold, sinus infection, or flu. And then there's preventative care. And preventative care is everything from childhood immunizations to colonoscopies and mammograms. Let me spend a few minutes talking about large costs. And again, we refer to these as needs. Simple examples would be surgery due to an accident, hospitalization, maybe some diagnostic imaging that the doctors are having to go through, an ER visit, or cancer diagnosis. These needs are best addressed through our partnership with Sedera. Sedera is a medical cost sharing, and for those of you not familiar with medical cost sharing, it originated in the 1980s and has had a foothold with religious organizations. So different churches or congregations would get together and form an organization through which their members could participate and share each other's healthcare expenses and lower each other's healthcare expenses in doing so. Sedera is not a religious organization. Their parent company is actually called the Caris Group, and the Caris Group was a medical bill negotiating company that was also formed in the 1980s. And they're the company many of the religious organizations turn to negotiate their larger bills. Well, when Sedera saw that all of our healthcare costs were rising at just an unsustainable rate, Sedera was formed by the Caris Group. And again, Sedera is not a religious organization, but it's based on the same best practices and principles as the religious organizations. And Sedera's objectives are really all of our objectives. It's compliance and credibility. It's lowering our monthly expenses and reducing our out-of-pocket costs. So depending on the program you sign up for, and I'll go through a few scenarios, it will definitely save you money in the front end with a lower monthly contribution. But for most of us, it also saves us money on the back end with a lower max out-of-pocket cost. A few brief comments on medical cost sharing in general. As you'll find out, it's big savings over the traditional health insurance that many of us have had. It's healthcare through community, which is how we save much of the money. Industry-wide, as of the end of 2017, there are more than 1 million members sharing more than $1 billion annually. It also offers freedom from networks. So when you do have to use your Sedera membership, you can go to any hospital you like, any doctor you like to get the care that you need. You do not have to operate within the network. Now on the Apex side, for your preventative care that I'll talk about in just a few minutes, you do have to operate within a network. But on the Sedera side, you don't. Now with Sedera, sharing begins as what's called your IUA, your initial insurable amount, on a per need basis. That's what you're responsible for paying if and when you have a medical need. And we have 5 levels to choose from, and we'll talk about those in just a few minutes. Here's a real quick slide that shows how quickly people have adopted the medical cost-sharing solution. You'll see the uptick there right around 2012 when all of our healthcare costs really started to increase at just an unsustainable rate. People started looking for another option, another solution. The Cela Healthcare Program is one of those solutions, and that's the program that we're talking about today. Now let's talk in some detail about how Sedera works. Again, we refer to these medical events as a need. So what is a need? A need is one or more medical expense caused by a single accident or illness. So as you can see on the graph there on the left, this is someone who broke their leg. There were costs for the ride in the ambulance, the stay at the hospital, surgery at the hospital, diagnostic imaging, crutches and pain medicine, or whatever other prescriptions were ordered, physical therapy. All of those costs are wrapped up into one need. And whether those costs occur over a period of months or over a period of years, the member's responsibility is that IUA, the initial insurable amount. And as you can see, we have 5 levels, $500, $1,000, $1,500, $2,500, or $5,000. And that's what the member is responsible for paying for out of pocket. So with the broken leg scenario on the left, if those total costs were, say, $10,000, and the member had the $1,000 IUA, they would be responsible for paying $1,000. The balance would be shared through Sedera and paid accordingly. Now that holds true if the bills were $5,000 or if the bills were $200,000. The member's responsibility is capped at that IUA. So like I said earlier, depending on the plan you choose, Sedera can save you or will save you money on the front end, but also on the back end with a lower max out of pocket. Now for folks who signed up as an individual, they're responsible for the first 3 such needs in the calendar year. If they sign up as a family, they're responsible for the first 5. If as an individual you had a 4th, or a family you had a 6 or more, you would simply not have to pay that IUA. Here's a real quick, real-life example. This is a family with a young child that had a persistent ear infection. Prior to Sedera, they had traditional insurance with a $5,000 deductible. The child had gone through a series of antibiotics and booster injections, and finally a visit with an ENT who inserted tubes into the child's ears. On the left, you can see the out-of-pocket costs with traditional health insurance with co-pays, and then the cost for the surgery that goes against that $5,000 deductible. So they had a total out-of-pocket cost of around $2,500. On the right, with the medical cost sharing through Sedera, if they had the $500 IUA, they would, of course, only have to pay the first $500 that they incurred. There are a few nuances to the plan. These next 3 slides will address them. It's membership, medications, and pre-existing conditions. Let me start first with medications. There are 2 types of medications we all take, those that are curative and those that are maintenance. Curative medicines are medicines we take for a period of time. There's an end date at which point we stop taking the medicine. That's when we're cured. So it could be antibiotics or pain medicine or chemotherapy drugs or things of that nature. The cost for these drugs is wrapped up into that IUA and through that example I just shared with the young child with the ear infection. So those costs are shared through Sedera and paid accordingly. The other type of medicines many of us take are maintenance type medicines. It could be for everything from high blood pressure to high cholesterol, maybe an overactive thyroid. I take it for rheumatoid arthritis. But these are medicines we take daily or weekly or often as the doctor has ordered them, and we will for the foreseeable future, maybe for the rest of our lives. The Cela Healthcare Program offers 3 options for people to choose from in getting those prescriptions filled. That second bullet there is the Apex plan. The Apex Advantage plan, which I'll talk about in a few minutes, is the other half of this program. And they have a great prescription drug program. And that's probably around 95% of our participants get their maintenance type medicines, including myself. I have rheumatoid arthritis. People may also want to look at a service like GoodRx. GoodRx is a great way to get discounts. Or they may want to look at Liberty Benefits. Liberty Benefits is an add-on for $27.50 per month, and they offer discounts for as much as 80% off the retail drug prices. A quick example of that was a woman who signed up, and her husband suffered from seizures. The medicine, just by nature, was quite expensive for a seizure medicine, so the most cost-effective way for them to get that medicine they took on a regular basis was by signing up for Liberty Benefits. But like I said, most of us, myself included, get our prescriptions filled to the Apex side of this plan. And I'll talk about the prescription drug coverage there in just a minute. Now, when members do sign up, they do have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices in diet and exercise can improve one's quality of life, but it also keeps us all out of the doctor's office and out of the hospital, so it keeps all of our expenses low. Obviously, striving to live a healthy and balanced lifestyle is not legally binding, but it is something that all members must commit to. Members also have to commit to not use illegal narcotics and not to operate a vehicle while intoxicated. So what does that mean? From a practical standpoint, what that means is if you are driving while intoxicated and you got into an accident and you had medical bills, those bills could not be shared with the community. The principle there is that the community should not have to pay for someone's illegal actions. Also, tobacco users are certainly welcome to sign up. Everyone is, but there's a $75 surcharge for tobacco users per month. Also, tobacco users age 50 and older have a $25,000 per need sharing limit on the top 4 diseases associated with tobacco usage, which are heart disease, stroke, COPD, and cancer. So for those of you who are still smokers, another good reason to quit, perhaps. This next slide is perhaps the most important. It was for me when I signed up over a year ago. And that's pre-existing conditions. As I mentioned, I have rheumatoid arthritis, which is a pre-existing condition. So I'll take some time here and talk about this slide. Now, if you have any of the top 4 listed there, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, assuming they are well controlled with medication, they do not have any sharing restrictions. Those conditions are all obviously very common and generally well controlled with medicine. If you have anything else that has been defined as having received a treatment or having a symptoms in the prior 36 months of signing up, then there would be sharing restrictions for those conditions. So let me use myself as an example with my rheumatoid arthritis. I had to disclose that when I signed up. Now, when I go to my rheumatologist, that's covered. I pay a copay. When I get my lab work done, that's covered. I get a copay. My prescriptions are covered. My prescription coverage is actually great. It's less than $12 for a 3-month supply of my medicine. But what this is addressing is if I were to have a need arise, if I were to say need surgery as a result of my rheumatoid arthritis, that's when this restriction would come into play. So in year 1, I would not be able to share the cost for that surgery. Year 2, up to $15,000. Year 3, I could share up to $30,000, meaning $30,000 will be paid. After that, it's fully shareable. So for me, signing up with my pre-existing condition was not an issue. It's a chronic condition, and it's something that I've had for many years and will have for the rest of my life. So these restrictions did not preclude me at all from signing up. Now, obviously, if my wife was, say, currently pregnant, or if I had an active cancer that I was receiving treatment for, now would not be the time for me to sign up because it would create a financial burden for me and my family, which is exactly what we're all trying to avoid. What we generally tell people is that the program itself is a great option for about 80% of the U.S. population to choose from, including those of us with pre-existing conditions. Obviously, if people have any questions on their conditions, please feel free to reach out to us and we can talk about it with you one-on-one. But those are the large costs. Again, that's surgery due to an accident, a cancer diagnosis, hospitalization, the more expensive matters, if you will. I'm going to switch gears and talk about small to medium costs. And again, this is the run-of-the-mill type stuff we all have at different times during the year. And it's a cold, a sinus infection, a flu, maybe a UTI. Included with everyone's membership is a subscription to Teladoc. If you're not familiar with Teladoc, Teladoc is the largest provider of telemedicine in the U.S. Telemedicine is now offered by more than 75% of the Fortune 500 companies in the U.S., and the reasons are simple. It's a time saver and a money saver. The way it works is if you have just say a simple ailment, let's say you just need a Z-Pak, you can connect with the doctor virtually over the phone or through your computer. You can do it from your home, your office, your car, wherever you might be. And if you need a prescription, the doctor will send a prescription to your local pharmacy. A great example is one of our members had an eye infection, and she connected with the doctor through Teladoc and used a video call service. He diagnosed what her eye infection was, sent a prescription to her pharmacy, and it was cleared up a few days later. There's not a copay involved with using Teladoc. There's no out-of-pocket cost for the member in using Teladoc. And obviously, it's a time saver because you don't have to go to your primary care physician or go to the urgent care or go anywhere to just get a simple prescription filled. I'll also include a SecondMD. SecondMD is a great way for anyone to get a second opinion on anything you're going through medically, of course. And it's from some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins and elsewhere. The reason this is there is there was a study that shows that the average doctor is about 13 years behind on his or her continuing education. This is a great way to make sure you have the most up-to-date information on anything you're going through. And again, there's no charge in using this. Also, if you're getting a surgery that is not required by a doctor, an elective surgery of sorts, Sedera requires you to get a second opinion, and you'll get that second opinion by using SecondMD. And again, it's done so virtually. It's not a heavy lift at all. It's really a great service to have. Now I'm going to switch gears and switch over to the Apex side. If you recall when I started, when you enroll, you actually first sign up and select the Apex plan that best fits you and your family, and then the Sedera plan. We've gone through the Sedera and how Sedera works. Now I'm going to talk about Apex because they offer coverage for the small to medium costs, but the real focus is also on preventative care. Now Apex has two options for folks to choose from. This first is the basic MEC plan. That's minimal essential coverage. It offers 100% coverage for all the preventative care needs that you see listed, 21 for adults, 28 for women, 31 for children. These are all the preventative care items that the Affordable Care Act defined and required us all to carry to avoid the IRS penalty. Now, the IRS penalty has gone away, but many states have adopted the penalty for folks that do not carry preventative care. This program solves that issue and would help people avoid any penalties by having this coverage. Now, this first option really just provides a framework for a health savings account. It covers all the preventive care 100%. After that, everything else is out of pocket, but you'd be doing so with tax-free dollars. As you may or may not know, a health savings account is a great way to put away dollars tax-free to be used towards any qualified medical expense, dental, vision, prescription, doctor visits, and also to pay your Sedera IUA. Now, for 2019, individuals can put away $3,500 and families can put away $7,000, plus those over 55 can contribute an additional $1,000. The money contributed does not go away. It's not like a flexible savings account where it's use it or lose it. Your HSA can roll over year. And when you turn 65, you can actually convert it to an IRA if you chose. Now, about 20-25% of folks who sign up choose this first option, the basic MEC plan, and they are folks that are in good health. They're not on any prescription medicine. They're looking for coverage for all their preventive care needs, and then also are able to pair that with the Sedera plan. And so it's a great option for those folks. The rest of us, myself included, are on the Advantage plan. The Advantage plan also offers 100% coverage for all the preventive care needs. And again, that's everything from childhood immunizations to your annual physical to colonoscopies and mammograms. Then it has a more traditional co-payment structure for your ongoing medical care. So when I go see my primary care physician, for example, it's a $20 copay. When I go see my rheumatologist, it's a $50 copay. My lab work's at $50. And then this option also has prescription drug coverage. The prescription drug plan is managed by Welldyne Rx, and you'll see it has Tier 1 and Tier 2 generics, Tier 3 preferred brand name. Those higher tiered drugs are generally associated with ailments that are more significant and more curative in nature. If you recall, when I talked about the different type of prescriptions we all take, there are curative and those that are maintenance. The maintenance drugs are generally in tiers 1, 2, and 3, and the curative drugs are in tiers 4, 5, and 6, and would be paid or shared through Sedera and paid accordingly. Like I mentioned earlier, the medicine I take for my rheumatoid arthritis is $11.88 for a 3-month supply. So it's an outstanding program. Now, when I talked about Sedera, I made note that Sedera does not use a network. You can go to any doctor you'd like, any hospital you'd like to get the care that you need. On the Apex side of your plan, you do have to operate within the MultiPlan network. MultiPlan network is one of the largest networks in the U.S. There are well over 900,000 participating providers in the network, and we have great coverage throughout the country. If you are living in a zip code and you'd like to see all doctors and facilities that are in network, you can simply shoot us an email and we can send you a list of all doctors and providers in that network. Now let's talk pricing and what all this costs. Now the pricing is the same regardless of where you live and regardless of your sex, so we're all on a level playing field here. This first slide is for the Apex pricing. On the left, you'll see member only, member and spouse, member and just the children, or member and the entire family, meaning spouse and kids. That second column there is the basic MEC plan. Again, that's with the health savings account option, and it does not have prescription drug coverage. You'll see it starts at $71 per month and goes to $102. And then the third column there is the Advantage plan that has the more traditional co-payment structure, and it has prescription drug coverage. And you'll see the arrow there. That's actually the plan I'm on for $144.59 per month. You would then pair that with a Sedera plan that best fits you and your family. And if you recall, there are 5 levels to choose from. It's $500, $1,000, $1,500, $2,500, or $5,000. For space reasons, we only have the $1,000 and $1,500 IUA listed here. But on the left here, MO is member only, MS is member and spouse, MC is member and just the kids, and MF is member and the entire family, spouse, and children. It then goes across by age, those in their 20s, 30s, 40s, 50s, and 60s. You can also see on this slide that the higher the IUA, meaning the more you're willing to pay out of pocket, the lower your monthly cost would be. And again, the arrow there on 175.51, that's the program I am on for 175.51 per month. So here's my monthly cost. It's $144.59 per month for the Apex side of the plan, $175.51 for the Sedera side of the plan. So my total monthly cost is $320, which, like I said, is right around 50% less than what I was paying on one of the Blue Cross Blue Shield plans, and I'm right outside DC. We've had folks in more rural areas that are saving 200% or more. So really what you pay varies quite significantly by where you live. On our plan, like I said, it's a level playing field. This program for me also has a $1,500 IUA. I chose the $1,500 IUA just because it's kind of middle of the road and it's amount I would be comfortable paying if and when I do get sick. But it also limits my max out of pocket. So rather than having a $6,000 deductible, which is what I had on my Blue Cross Blue Shield plan, I now have a $1,500 IUA. So if I did break my leg and need the surgery in the scenario we talked about earlier, my out-of-pocket cost would simply be $1,500. Now, on our website or on your organization's website, you're going to find all of the following. Current rate sheets, details on the Sedera plans, details on the Apex plans. There's a great FAQ on telemedicine as well as 2nd.MD and the multi-plan provider search. And like I said, if you'd like to know what providers are in or around your area, just send us an email with your zip code. We'll run that list for you pretty quickly. A quick summary of the offering. The program, as of today, is in 48 states. It's currently unavailable in Vermont and South Dakota. South Dakota should be resolved in a couple months. The plan itself does not need an employer sponsor, so individual employees can join. It's available to full-time, part-time, and seasonal workers, hourly and salaried staff. The monthly cost can be paid by the employee or the employer. So if you're an employer and you would like to offer healthcare, or you do offer healthcare to your employees, and you pay the bill and then offset it with a payroll deduction. All you have to do is send us an email. We send you a simple form, and we get your company set up. It's done in less than 24 hours. If you're an individual, you simply enroll through your organization's enrollment platform and sign you and your family up directly. Obviously, it's a terrific benefit at no cost to the company for companies that do offer it. It's a great way for employees to attract and retain talent, which is what we've heard from many of our employers and companies that have signed up as to why they are signing up for the program. Also, that bullet there, like I mentioned at the beginning of the webinar here, the average savings we're seeing is right around 60%. Like I said, for those in more rural areas, the savings is significantly more. Also, I do want to note that in the fourth quarter of 2019, perhaps as early as October 1st, we're going to be adding a dental plan through Aetna. There'll be two choices there, one with orthodontics, one without. And then later in the year, vision coverage through VSP. So with that, certainly like to thank you all for your attention today. If you have any questions at all about the program, please feel free to reach out through your local organization or email us directly.
Thank you for spending this time with us today, Kevin, and explaining the new healthcare program being offered by Keys to Health. As you can see on the screen, there are several ways to get a hold of us. For support, please email membercare@keystohealth.org, or you can call us at 877-622-9990. And for general inquiries, email info@keystohealth.org.